From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
9 minutes now before 11 o'clock. It's October, and that means Breast Cancer Awareness Month, and a treatment for breast cancer that has been talked about for several years but is actually being performed now is partial breast radiation, where just the breast tumor area is treated with radiation following lumpectomy instead of the entire breast. Dr. Anu Gupta is with Associates in Radiation Oncology, and she joins us from time to time to talk about advancements in medicine. And this is one that really is, and actually you're involved in a clinical trial right now that's out of Johns Hopkins in Baltimore. So you're actually looking at this procedure.
That's correct. It's a clinical trial that involves use of chemotherapy and partial breast radiation. So chemotherapy is given along with the radiation. Radiation is done within a week, as opposed to standard treatment that takes 6 to 7 weeks of daily treatment.
And it's another example of how we're becoming much more elegant in our treatment, and that we're able to focus just on that part of the diseased breast. And when you're using radiation, if you can focus it that much more, the outcomes can be that much better.
Well, that's the hope.
That's the thought anyway.
Right.
Yeah.
And that's so far right now the data is looking fairly promising for certain women. It's not a standard treatment, cannot be offered to all women, but it will cut down on side effects and it shortens treatment times.
And it gets us to another point that I want to make, and that is early diagnosis. If you can find these tumors at their earliest and most treatable stage, then you have more options like this.
Yeah, partial breast radiation right now is only indicated for early stage disease. So again, early diagnosis is important.
And it's why we make that pitch just about every time this comes up. Let's talk about the partial breast radiation, because there are a couple of ways that you can do it.
Right.
One is, as you talked about this, the high dose. Explain how that works.
So partial breast radiation is exactly what it says. It's partial breast as opposed to whole breast. So there's two ways it can be done. One is the use of a catheter placed within the lumpectomy cavity or the breast tissue itself. And then as an outpatient, the patient comes to the radiation oncologist, gets hooked up to a machine with the radiation, that catheter. The radiation sits there for a few minutes, comes back out, and you leave. You do this for a week, twice a day. That's called a high dose rate unit. And so that service is available at, for example, my office, at a variety of sites. The other form of partial breast radiation is the linear accelerator or machine from the outside that gives you doses of radiation, again, to the lumpectomy site itself. So there's no catheters, but it's just a machine from the outside. And that's the same concept, twice a day for a week.
You never want to get ahead of yourself in a study like this, but what's your gut feeling? Is this one of those things? It is not the answer, but it is an answer.
I think it is one of the potential answers for certain women. People who have difficulty getting in and out of treatment every day for 6.5, 7 weeks, early stage disease, that people have other medical issues, that kind of thing. So I think it will become part of a treatment regimen, not the only treatment available.
Longer-term radiation can have very debilitating side effects that come with it. What about in the partial
So
breast?
far, studies are showing that the side effects are actually minimal. The cosmetic results are good. But again, these are highly selected patients. So, and I think that's going to be the key. It cannot be, it will be a mistake for some women, but it'll be a great option for others.
Dr. Anu Gupta is with Associates in Radiation Oncology, and we always look forward to her visits. For more information, check out raddocs.com on the web.